So like when you are treating the any shoulder conditions, there are lots of muscles coming from the posterior side of the back, right? So I treated it already when you are not seeing. Okay, so I already did everything in the back, and then the compensation that side too. So and I'm ready to kind of working on more specifically for the shoulder, the AC joint. That's why I have him like this position. I already did everything else. Okay. So from here, like after you loosen up all the muscles here, maybe you feel like, oh, I should perform some friction on that spot. So then, you need to find the right spot for the friction, right? We talked about it. Oh, sorry. We have the clavicle coming here, and then there is the acromion is hooking around a little bit. So where you can find the AC joint is not at the side, it's at the anterior side of the shoulder more, right? So once you locate the joint, if it is the cross fiber friction, then what is the direction that you have to do the friction? It's gonna be like along the joint line, right? Because of the all the ligament is cupping on the top of like clavicle and then the acromion like that way. So fiber direction is this. So then your direction, cross fiber direction is like along the joint, right? So once you feel the joint, you can use the reinforced finger or like the thumb, whatever you feel comfortable. So you can go that spot to perform some friction on it, right? So once you start to perform some friction after you find the restriction, you're gonna check your patient pain scale. They say like, oh, it's 4, and then let me know if it goes down. And then what if the pain scale doesn't go down, which means it's gonna be you are doing something wrong, right? So then you need to adjust the pressure, give some time to rest or stop, right? Maybe it's too early for them to take that, right? So the pain scale should goes down, right, from 4, 3, 2, and then like what do you need to do after? You need to stretch the tissue, right? So then what do you need to do for the joint, like here, like joint capsule or ligament? For the muscle, you know how to stretch the muscle, right? But for the joint, what you can do here? You can perform a little bit of the joint play technique, right? To give the little bit of the stress to the tissue, so tissue knows that where it has to grow. That's the purpose of giving a little bit of the stretch to the tissue after the friction. So you can perform the joint mobilization technique here to give the little bit of the stress, which is you can do it like you can perform anterior or posterior glide a little bit by holding here and then end of the clavicle. Are you okay? Usually it can be tender for the patient. So if it is too much slippery, then you can use their sheets over the clavicle to hold it, or it's okay, then you can hold it. Then you can just do wiggle a little bit anterior, posterior to see that it's okay or not. See? Or you can try to cupping the acromion side only, and then give the little bit of the distraction to the joint too. Like one side is stabilizing. Sometimes you can have the pincer grip or like holding down too, and then acromion, and you're gonna try to separate it to just give a little bit of distraction to the joint too. Okay? So after you stretch there, and then what you need to put there? Ice, right? And then your patient may need like 2-3 times to repeat that again, or after one time you see that there is no restriction anymore, then you don't need to, right? So depending on that, you can perform the friction massage there. And because of the injury happening, like fall onto the shoulder, right? So then there is a compression first toward the, not only the AC, toward the SC too. So when you are checking your patient joint, I'm gonna explain that a bit further. So then your patient may have some types of the pain at the AC joint too. So you can perform some distraction for the SC joint too. So you can hold like with the cupping motion for the sternal side of the end of the clavicle, and then push out to distract the joint. Or you can have the pincer grip to move it away. So depending on the comfort level, usually, you know, I don't like my patient to feel like too much my nails, even though I cut it short. So this is more comfortable for me to do it in that way instead of like that way. But sometimes it's easy to just grip it where their clavicle is so obvious. Then you can kind of grip the portion close to the SC, and then you can move away from it too. Are you okay? Yeah. And then you're gonna loosen up all the muscles, like the upper trapezius especially, and then the deltoid. If it is tense too much, then it's gonna give the stress to the AC joint too. But there is other muscle that attach onto the clavicle too. What else? Like there's a SEM, right? And then there is a subclavius muscle, and then pec major muscle is kind of around that area too a little bit, right? And then goes all the way down. So those muscle is a good target for you to kind of loosen it up when you need to decrease all the hypertonicity there. And have you kind of worked on the subclavius muscle before? Yeah. So like there is a position that you can have your patient arms all the way out, 130. And then you're gonna go to the 1/3 of the clavicle, and you're gonna hook underneath of it, so your pressure is gonna be go underneath up, so posterior and superior like this. So sometimes index finger is easy, sometimes you can reinforce your finger, sometimes it's thumb, depending on your comfort. And then put it in, and from there you're gonna find the muscle. Sometimes your patient has some trigger point there, then where the pain refer to for the subclavius muscle.
To the elbow.
So dosum side of their thumb, and then the index finger like that way. So if your patient may refer report that they may have the trigger point there once you palpate there, and then you can kind of slide your finger away to loosen up that stuff. Clavius muscle too. That's it. So mostly you are working on the back muscles first, then turn them over. Specific work for the AC joint, or you can kind of working on here first, and then at the last here too, because it's gonna be more general and specific, right? The order, and then you're done, right? So you can perform some joint mobilization for the GH joint too, just for the maintenance. So just to be careful when you perform the long axis distraction, because when you pull it, you're gonna give the stress to the AC joint too, right? So always communicating, like you can do it. Just be careful with your patient. You need to communicate. Do you feel any weird feeling at the AC joint or not? And then you will be fine. You're gonna start from the grade 1 and 2, right? Other than that, it should be fine. Yeah. Is there any questions?
For AC separation, I thought it would be a CI to do distraction because you're pulling that joint even more. But
It depending on the stage, right? So like if it is in an acute case, and then you will see that there is a even step deformity, like with the grade 3 or up. So then that's not your first technique to start. But like when you reach to the chronic case, especially the one that we checked the case 2, right? It's all the injury, just had a discomfort there. So then you do need to perform some joint mobilization to have him to have the full range without the pain. And then first grade 1 or 2, even acute phase, you can try, because it's grade 1 or 2, you will do nothing much harm on it, but it's better to do it from the subacute. And then grade 3 and up, it's gonna be definitely in a chronic stage, and you can do it. Sometimes you have to do it, unless your patient is showing the hypermobility at the joint.
okay.
Any other questions? Good. Ready to practice? You guys don't have much time, maybe